Good morning, everybody. How's everybody doing this morning? I want to take a quick second, thank everybody for joining us for what's been our fourth Boston Marathon Jimmy Fun Walk Town Hall as we prepare ourselves for October 4th and our first Jimmy Fun Walk your way. Quick housekeeping, as prior calls we've done before, just bear with us if there are any technical issues. Also, if you have any questions, please make sure that you're sending them through the Q&A functionality at the bottom of your screen. All our attendees are on mute and your cameras are disabled as well. This town hall is being recorded and will be shared in an email tomorrow. We're going to jump right into it. We got a packed agenda for today. And we're going to give you some really great updates and some things around the walk itself towards the end of the town hall. But before we dive into that, I'm excited to introduce you to our first guest speaker today, and her name is Amy Ennis. Amy is the team captain of the walk team Bushy Strong. She's a two-time pace setter, a member of Walk Captain Circle, a wife, a mother, a friend, and a cancer fighter. I am beyond excited for Amy to share her story with all of you, and I think you'll find it truly inspiring. Amy, thank you for joining us, and I am turning the camera over to you.
Hi, everybody. Zach, thank you so much. Jess, Steph, your whole team, thank you for everything you do. Thank you to the walkers, all the donors, and especially to my team, Bushy Strong. I'm excited for October 4th. So my first experience with Dana-Farber was, as most of us, came out of nowhere and shocking. I had severe abdominal pain, which led me to the ED back in March of 2016. It was really just a few weeks after my daughter's first birthday, my husband's 40th, so we had a lot going on. Went to the ED thinking, you stay here with the baby. I'm sure it's nothing, I'll be back. Maybe it's appendicitis, I don't know. When they found a tumor in my colon, I was beyond shocked. I went into fight mode right away, put my project manager hat on and said, where am I gonna get treatment? How am I gonna get better? And immediately Dana-Farber came to mind. So as a stage 4 colon cancer patient, my team consists of many different people. So I have my oncologist, my nurse practitioner, who I see every 3 months, but can also contact at any time when I need them. I've seen surgeons, radiation oncologists, many amazing nurses. I have a nutritionist who has taught me so much about the things I'm putting into my body and how important that is. Social workers, acupuncturists, psychiatrists, really anything I've needed, I've been able to turn to people at Dana-Farber for that. So I've had 5 major surgeries since I ended up in that emergency department almost 5 years ago. 2 different chemo regimens, 12 rounds of each. And today we are kind of in a watch and wait state. I feel great. I'm doing everything I can to keep my health. And my next scan is in a couple weeks. So if you guys can have some good thoughts and prayers for me, I truly appreciate it. So I got into the walk. I had heard about the Jimmy Fund. I think most of us have. I wanted to get more involved, raise awareness on young onset colorectal cancer, which is a growing problem for many young people. Dana-Farber has actually created a young onset colorectal cancer department, one of the first in the country, in the world, to show how important this issue is and to really raise awareness that this isn't just about 60-year-old men anymore. This is about young people, and we really need to focus on it, raise money for it. So once I found out I could direct the funds that I raised through the Jimmy Fun Walk directly to my oncologist and the department, I was completely sold on using the Jimmy Fund as my go-to, as my raising awareness, but also raising money for a great cause. So the funds we've raised over the last 5 years, it's done a lot of different things, but one thing I want to mention is something called patient-reported data, or PRD. So patients can now, when they leave the office and start feeling different symptoms, can report those symptoms from their iPad, from their phone, from their laptop, or if they don't have those devices, they can do it in the waiting room at Dana-Farber where they're waiting to see their doctor. So what we found is it improves patient outcomes. It increases efficiency in your appointment with your doctor. You're not forgetting things. They already have it in front of them. And it also enables better data tracking for research, for discovery and innovation. You know, as a patient, some patients get treatment every other week. So I'd have chemo week, then I'd have a week off. Then you go back. So by the time I was going back, I remember feeling great. It was sunshine, rainbows, unicorns, everything was wonderful compared to the week prior. So what was missing in my conversation with my doctor is how horrible I felt a week ago. So once this was rolled out and these questionnaires were available to me personally, I was able to say, okay, it's Tuesday. I'm done with my pump. I'm done with my treatment for this week, but I still feel so nauseous. I'm so tired. I'm constipated, or I have diarrhea. All of these symptoms that don't really warrant a visit, but they need to be tracked and they need to be reported so your doctor can help you. So it's just amazing to see exactly where my money goes, and as a patient to actually use it and see that money in a positive light. So that was the main reason that I joined, but I learned so much more after. So it means more than that to me at this point. It's great to raise awareness, raise money, but me and my team look forward to it every year. We all know that that day is something we're going to be dedicated to. We plan for it, we catch up, we celebrate, we laugh, we cry, but we really pause to remember anyone we've lost, everything we've been through, and to focus on how far we still have to go. You know, we recognize that. And I also love how my 5-year-old daughter just gets so involved in it. A perfect example, last week we were doing some landscaping around the house, you know, getting all those house projects done during COVID. And I was shoveling stone into the wheelbarrow. She was helping me with her little Paw Patrol shovel. And I was starting to get tired, so I put the shovel down, and she looks at me and she goes, "Come on, Mom, pretend it's the Jimmy Fun Walk. You can do it." And I just smiled from ear to ear. It was the best moment ever. So this year, it's obviously a little different, but it's still going to be memorable no matter how we do it, where we do it. We're going to join each other on Zoom. We're all going to do it on October 4th. We're going to take pictures if we're not together, and we're going to celebrate as best we can, but we are still dedicated to that day, still dedicated to raising money, and the need hasn't changed. So that's really our focus for the walk.
Thank you, Amy. Thank you for sharing that story and your journey. You know, I can just tell you on behalf of all of us how lucky we feel to have you to be a part of the walk community, like so many others on the call today. I had one quick question before we let you go. Many people on the town hall, you know, would attest to the Hero program and seeing those inspirational signs on walk day and all of those things. And I know you've been somebody who's been a part of the program before. I'd love to just hear a little bit more about your experience with the program. I know it's gonna be a little different this year. We won't have posters for people to, you know, touch when they're walking on their own routes and things like that. But just for somebody that's been a part of it, I'd love to hear just a little bit about your experience.
Of course. So it was really an honor to be asked. I mean, everybody wants to be a hero, right? So the thought of my face and quotes that I've said to inspire other people just really warms my heart. Last year, I was paired with Jounce Therapeutics. They're a company out of Cambridge, and they are dedicated to cancer immunotherapies, you know, looking at different ways that immunotherapies can help treat cancer patients. So not only are they working towards cancer treatment every day, they also have a huge team, and they raise money for the Jimmy Fun Walk every year. So they invited me into their office, tour their facility. I met scientists. I told my story to their team. I toured the labs. I saw them, you know, in their innovative world, just trying to help cancer patients. And it was truly, you know, if I wasn't a part of the Jimmy Fund Walk or the Hero program, I would have never known the company even existed, to be honest with you. So things like that, meeting people like that is such a benefit of not only the Hero program, but the Jimmy Fund Walk. I've met some friends that I will have for life. It builds your network. It builds relationships. It's just something, those are the things that I didn't think of in the beginning when I joined. You know, I thought I'd have fun with my friends and family and we would be doing our own thing, but it's really a lot bigger than that. And the Hero program is a wonderful addition to the Jimmy Fund Walk. Seeing those faces, those quotes, they really inspire you along the way. So it's sweet. And thank you for having me as one.
Of course, of course. Well, awesome. Thank you. Thanks again, Amy. It's again just an honor and a pleasure to be able to have you be a part of the program, to be a part of the Jimmy Fund Walk in our community. And I know the many folks on this call would echo those thoughts as well. So thank you so much for all you do for not only the Jimmy Fund Walk, but Dana-Farber in general. I am excited now to introduce our next guest speaker for today, Ildemaro Gonzalez. Ildemaro is the Vice President, Chief Inclusion and Diversity Officer here at Dana-Farber. At Dana-Farber, we're committed to an inclusive community where human differences are valued and celebrated. Creating an innovative, caring, and inclusive environment for our patients and their families and our staff is a top priority. And Ildemaro and his team have done an amazing job fostering this type of environment. And we're really excited about to hear some updates from Ildemaro this morning. So Ildemaro, thank you so much for joining us today.
Thank you, Zach. And I want to start by thanking Amy and her story. You know, when this is why we come to work every day, to hear stories like yours and to be able to celebrate that fifth birthday with your daughter. That's what motivates us. And in particular in your story, you talked about, you know, immediately Dana-Farber came to mind. And our work is precisely focused on ensuring that everyone, you know, has Dana-Farber immediately on their mind when something like this happens, when cancer knocks your door. I also want to thank, because I'm sure your story is replicated along the walk community, I want to sincerely thank all of you, the Jimmy Fund Walk community, for your dedication to our mission and what you bring to us and the funds you raised. We couldn't do it without you, and you re-inspire us and you motivate us every day. So if you can advance to the next slide. You know, when we think of inclusion, diversity, and equity at Dana-Farber and how we execute on that commitment that Zach was talking about, right? We focus on ensuring that our initiatives and our strategy impacts everything we do at the Institute. So within the research arena, the clinical care, our people agenda, and then our community work. Within our research agenda, we're mainly focused on ensuring that our findings and our research is applicable and the results are valid across all populations. What you see here is a series of, you know, goals, specific goals and metrics under each, but I'm gonna talk a little bit about how this comes to life. So when we look at providing better care to more people, it's precisely Amy's story. And that conversation that she was having, and Amy, I have to say, and I'm gonna read here. She's a fantastic human being and a fantastic champion of PRD, patient-reported data. I just texted Dr. McCleary and telling her I was in a meeting with you and what a story I was hearing. That's precisely part of our focus here within the providing better care to more people. That third goal over there, ensuring parity of cancer care quality outcomes across all patient groups. That's what that process helps us understand. We want to ensure also that the experience of every patient, all diverse patients, is equal and great for everyone. We want to increase minority patient volumes when it comes to our clinical care. When it comes to our people, it's more of the traditional aspects of what you expect in inclusion, diversity, and equity, where we discuss our opportunities to diversify our leadership and to ensure that everyone at Dana-Farber is having a great experience. So how does employee retention vary across groups? Our focus on community is one around ensuring that we increase access to prevention, early detection, and care for medically underserved communities, our Boston communities. Maximizing career, and this speaks to our many programs that we have with Boston Public Schools and other school systems to bring individuals in from underserved communities and expose them to careers in healthcare. And lastly, making sure that every patient, regardless of who you are, whether you're young or old, whether you're rural or urban, whether every patient has a positive perception of DFCI and has us top of mind when disease touches their life. If you can advance to the next slide. So in addition, as people say, right, you could put up nice statements and you could put up a very good strategy, but if you actually don't execute, then nothing matters. We've tied specific actions to each of these goals, and you see a couple of them there, or our focus for 2020, and pointing our partnerships with BMC, with the Boston Medical Center. We're starting a research partnership to ensure that our findings have increased access by minority patients. Our cultural competent care, LGBTQ care programs, our patient experience gap analysis, all focused on ensuring that that experience is equal across all patient groups. Ensuring career growth for our employees and so on. I want to point out that in one of the key outcomes, or one of the key decisions we made last year, was that we tied all these outcomes, or some of the outcomes of inclusion, diversity, and equity, to executive compensation, to really send a signal that we are serious about this. If you can go with the next slide, please. As we were moving along last year, then all of a sudden in the winter and spring this year, COVID hit. And during COVID, we started hearing many things across our, in the community, how Asian communities were being targeted as their connection with what was the first public understanding of where the virus originated. So many of our Asian community members were being targeted with jokes and comments and statements and even aggressive behavior. What we also found out was that some of that was also happening in the Institute, right? So we started looking at what we could do. We also understood as time went by, we understood, okay, as an institute, we're having to put in place mitigation strategies, and from an inclusion, diversity, and equity perspective, that meant, right, how do we protect, right, those that are in the lowest wage earners in our organization? How do we support working parents that are now having to work and be teachers and be caregivers for their adult patients at home? So a lot of the inclusion, diversity, and equity work went into that and continues to be in that. And then George Floyd and the incident we all are aware also hit. As a result of all of this and the fight for social justice, and Jessica, if you can please move to the next slide. We actually came out to the Institute and we said, okay, this is what we're going to do, and we're going to do this again. We're going to listen. We're going to put in place a series of listening sessions to ensure that we that we capture anything that we have missed in the past. We're going to act differently and with true intent, and we're going to sustain what we're doing over the months and years to come, right, by holding us accountable. So what you see on the right there is the funnel of how, from the Boston Globe article in late 2017, we did focus groups early in 2018. We did a roadshow last year, capturing more and more just listening and capturing input. And then just this, over the past 2 months, we've conducted an additional 30 sessions to understand some of the needs and some of the opportunities. And what we find is that many of the specific themes remain consistent across all of these. So this, and if I can move to the next slide, please. So this is where, as an institute, right, we have our first plan, which is the plan at the top, right? And then we're moving into One, verifying or updating some of the strategies we discussed there and actions. And two, we're now driving this down through specific area or division action. And what you have underneath the plan at the top, which is the Dana-Farber plan, you have the Jimmy Fund plan. So the Jimmy Fund came together and actually then decided, discussed, all right, how do we support this plan? And that is what drives our accomplishments. And that is what drives stories like Amy's across all patient groups. The Jimmy Fund is looking to foster an inclusive team, to engage diverse supporters and tell an inclusive story. And just this change of the walk from the traditional walk to now a virtual setting, right? The Jimmy Fund your way. That is the kind of mindset that we need to leverage, and we will leverage, and we are leveraging to then ensure that we can be equally impactful and that we're welcoming of all community members into the programs and services of both the Institute and the Jimmy Fund. So this is a little bit of of an update, and I want to again thank you all for having me, and Amy, and congratulations on your survival and the many years to come. Thank you.
Thank you very much, Ildemaro. I think we understand always, but especially in these times, how important this work is and how much focus we need to have on it. And we really are extremely appreciative of all that you and your team do to continue to make Dana-Farber, as inclusive and as welcoming as possible for all of our staff, our patients, their families. And I know I speak for all of our walkers when I thank you for your efforts. And I know you've got a meeting to get to, so we won't hold you up here. But if anybody has any questions as we're kind of finishing up the session here, just provide them in the Q&A, and we will get them over to Ildemaro, and we will get answers for anybody in the follow-up email as well tomorrow. So again, just want to thank you, Ildemaro. Thanks so much for taking time with us this morning.
Thank you, Zach. Thank you, everyone.
Now to switch gears a little bit, I want to provide a little bit some updates, some walk updates as we look ahead to Walk Day, which unbelievably is, it's about 5.5, just under 6 weeks away, which is crazy. It's the summer remarkably feels like it has taken forever, but also feels like it has gone by in a flash. A quick update on our Charity Miles app. If you joined us for the town hall last month, we did a walkthrough of the app and how you can use it to train for the walk, check out DFCI content, post to social media, help you fundraise. We hope that you've been able to take advantage of the resource. And if you haven't, please don't hesitate to reach out if there's anything we can do, to help. And many of you probably saw we put a challenge out to our walk community 2 weeks ago to help us raise over $100,000 over the course of the week from August 10th to August 16th. To help us secure a $20,000 gift from our sponsor, Schneider Electric. And we sent out an email, but of course, this comes as no surprise to me, no surprise to anybody on our staff, probably no surprise to any of you that walk, considering we really do feel like we have the most dedicated group of walkers and supporters that we know of. But we easily surpassed that goal and raised $164,000 that week. And Schneider was actually so touched by that they upped their commitment and gave us $30,000 as opposed to $20,000. So a big thanks to them for doing that. And of course, a big thanks to all of you, anybody that sent an email or posted on social media and just did anything to help us to hit that goal. So very, very excited about that. And we will have more things on the app and more challenges and exciting things that you can be a part of as we get closer to Walk Day. So if you haven't downloaded it yet, certainly encourage you to do so. We do have our Summer Steps Challenge, which is sponsored by UFOS. That's coming up actually at the end of this week. It will end, but actually on next Monday. But anybody that walks or logs at least 75 miles on the Jimmy Fund Walk app, on the Charity Miles app, by September 1st receives a Jimmy Fund hat. And the top 5 people who have the most individual workouts will receive a full Jimmy Fund walk swag bag, if you will. We will have drop-in sessions over the next month to offer assistance with the app and answer any questions. We really want this to be something that you're comfortable using. It's going to be a big part of Walk Weekend if you're able to access it. Everything will also be available on the web, but to have it kind of at your fingertips as you're walking and things like that. There's podcasts available to listen to. It's a really, really innovative program. So the link for these drop-in sessions to help you will be in the follow-up email tomorrow. I want to give a quick update on our mailing with all of your Jimmy Fun Walk swag, as we're calling it, all your shirts and your hats and all that kind of good stuff. As a reminder, we talked a little bit about this last month as well. This year, in an effort to kind of combat cost and things like that, all of your mailing will be combined into one big swag mailing that will be sent directly to you. So in the past, we've had team captains collect all the walk shirts and then pass them on to their walkers, and in an effort to A, socially distance, and B, be able to keep it a little bit under control and allow everybody to have everything. It's being sent directly to the walker. Okay. The key to that, and I'm assuming many of you, if you're on this town hall, are registered, but when you're doing your recruitment still to get more people registered, to build your teams and things of that nature, please note that the deadline to register and receive this mailing is September 7th. So if you register after that date with the warehouse and the vendors that we're working with, we will not be able to get you those materials before the walk. You'll still get those materials, but you will not get them before the walk. Anybody registered before September 7th will get their mailing sometime around September 24th, 25th, right around, give you a couple of weeks before walk day to do what you please with them. What's in that swag mailing is your walk t-shirt, provided you're one of the first 5,000 walkers. And as of today, that would be all of you. Your bib, whether it's a pace setter bib or a regular normal white Jimmy Fun Walk Your Way bib. Your medal, your I Walk For sticker. So those of you that have walked before, you see those all over the route, sticker where you would write the name of whomever you may be walking in honor of or in memory of, or simply in support of. Mailing labels for mailing in donations that you may have. A Jimmy Fun Walk hat for our first time walkers only. If you remember, we've tailed off on that a little bit this year in an effort to combat costs a little. We've gotten a lot of feedback from many longtime walkers that say, I've got enough Jimmy Fun Walk hats that I don't need another one this year. So we're giving those only to our first timers who wouldn't have a hat yet. Anybody that logged 75 miles as part of the Summer Steps Challenge, your Jimmy Fun hat, not walk hat, but Jimmy Fun hat will be a part of that. And some additional items that we're still kind of putting together for you. So it'll be a really nice package. And hopefully when you get it, it'll be a nice reminder that, while the walk, again, we've said this time and time again, is different this year, we hope that getting these things in the mail and seeing visualizing all these items will help to really just energize and excite all of you for October 4th or whenever you do your Jimmy Fun Walk Your Way. A quick reminder on our Top 250 Club. We are again having the club this year. It's an exclusive honor that reflects our top 250 fundraisers for the walk. 250 Club members receive a customizable bib via email this year. Will not be a physical bib that you get in the mail in recognition of their accomplishment. And the deadline for our Top 250 Club is Wednesday, September 30th. So those bibs will be emailed to you on Thursday and Friday, October 1st and 2nd, prior to walk day. A quick reminder on our fundraising recognition program. Again, something that we briefly talked about on our last call, but that is back again. You've probably seen emails over the last month as you're continuing to climb up the fundraising ladder. When you hit certain levels, you'll be notified that you've done that, and then kind of move on to the next or what's available for you at the level. You can see the redeemable prizes on the slide here that you're able to get. But we hope we share this with all of your team members and help motivate them to raise as much as they can for Dana-Farber. And this program has been very successful over the years in helping to increase our per walker fundraising average, which I can tell you is best in class out there. And we hope that we can continue that again this year, even in these times. As a reminder, there'll be an email in November with instructions on how to redeem your item, but also this is an opt-in program. If you prefer not to receive anything, you simply do not have to act when you get that email in November. You don't even have to opt out. You just don't have to opt in, if that makes sense. So just wanted to make sure that everybody is aware of that. So walk weekend itself, what is, we're starting to really formulate plans around all that, and what is it going to look like? And I hope you all are starting to do the same thing. We're not going to give away too much of what we're going to do yet, because we want you to be surprised and enjoy it. And we've got another town hall in September that we're going to talk about it in. But as I mentioned in the last town hall, we've received a lot of questions from you all looking for suggestions and tips for how do I plan my own walk. I mean, you guys normally do this for me. How do I do it myself? And I will just start off by saying, as I did mention last month, we are really discouraging folks from going to the Boston Marathon route to do their walk like they would in a normal year. There's not going to be any police presence for police details to make sure the roads are safe. There's no refueling stations. There's no volunteers out there. So it's not necessarily, especially those of you that have done the full marathon or planning to do that, the beginning of these routes, it is a safety issue, and we want to make sure that we are stressing to people, please, that we are discouraging you to do that. And additionally, of course, we ask that you always refer to your state guidelines, whether you're Massachusetts or not, to what is safe and appropriate given our current state of COVID-19. We know, many of you are looking to do stuff around your neighborhood, your town, your local streets or walking trails and things like that. And how do you plan that? What do you do for fuel, for food, for drinks, for restrooms, and all these things? How do I make the day feel like the Jimmy Fun Walk? So we have some suggestions. We'll go through each category a little bit. But a lot of it is going to be, if you have detailed questions on that, you always can just reach out to us. So the route itself, I think that's kind of the number one question that comes up. How do I map out a route? And when planning it, I would just say, really, it's best to think about the estimated distance that you're looking to walk, right? Start with that. And perhaps it's the distance you normally do on walk day. It's 26.2 or 13.1 miles or 10K, 5K. Or maybe it's, you say, hey, I've got a 10-mile loop in my town. I'm going to do 10 miles this year. It's a little bit different, but I know what this route is. I know I can do it. It's mapped out. It's easy. Any one of those is completely fine. But if you need help, I would, one of the, a website that we've used quite a bit, I've used it myself for years, mapmywalk.com. And, you can just try to map out certain things. It allows you to, like, with the fingertips, just kind of go in and plan a route when you type in your address and find, it'll map out exactly how far it is and all that kind of good stuff. I would definitely recommend using that. And additionally, I would recommend, once you have that route, if you're not overly familiar with where you are, that you drive it quickly and just ensure that there's sidewalks, ensure that you feel safe when you're out there, and that the distance does work for you. And then I would think that the biggest kind of issue or question mark when it comes to a route is, what do I do about restrooms? If I'm going to be walking, 26.2 miles or 13.1 miles, or even, a 10K, 5K, I might need a break at some point to use a restroom. And so it's kind of funny. Who would think you'd miss the porta potties on walk day, but I guess we will. What I've seen now as we're in this COVID world is, you can't just necessarily now walk into, like, your local coffee shop, your local Dunkin's, and just say, hey, you need to, or Starbucks, and just say, hey, you need to use the restroom really quick, like you normally could with what's going on in the world right now, they're not really allowing folks to do that as much. So if you are planning on doing that, I might check in with those places beforehand. But with that being said, I would plan a loop course or some sort of course that is going to go by either your house or a team member's house that you are comfortable with, that maybe you've had some sort of quarantine with, that may be the best option. It allows you to kind of loop around, stop home every X amount of miles, use the restroom, grab a snack, grab a drink. It just does make it a little bit more convenient. So that might be something that you would want to think about. I would recommend that. And of course, additionally, again, always remember to follow any of the guidelines. I would absolutely bring a mask or a face covering. If you need to go into any place like that, you want to make sure that you are, compliant and ready to go. the fuel, the food, the drinks, what do you do? Normally you guys have 12 refueling stations and they're stocked with snacks and water and body armor and all these other Gatorade, electrolyte drinks and things like that. How the heck do you do that, right? And so we've received a lot of questions about what's the best things to eat and drink. And, I would start it off by, if you have real questions about that, I would always recommend you check with your doctor, you check with a nutritionist, somebody like that, if you're concerned about it. But we can offer some suggestions on what we normally offer, which has been very effective over, the last 31 years going into this year. So for beverages, you really need to have a mix of water and then a drink with some electrolytes, a Gatorade, a Powerade, a Body Armor, any one of those electrolyte drinks. It's very important that you have a mix of the two. It's also really important to drink, even if it's not hot. I mean, it's October 4th. Now, could it be 85 degrees? Absolutely, it could. But it could be 60 degrees. You got to stay hydrated regardless. And the most important thing I can say is, if you're feeling thirsty, it's almost, I don't want to say it's not too late, but you shouldn't feel thirsty. You should be drinking enough so that you're not feeling thirsty, if that makes sense. For food, we usually have bagels and bananas and all those types of things at our start lines. Start your day with a bagel, a yogurt, a cereal bar, banana. Great way to build a solid base of energy throughout the day. Snacks you want to have on hand. Again, fruit, trail mix, granola bars, pretzels, crackers. You want that like mix of salty and also some substance. If you're going to be walking a longer distance, as we always have our lunch stop for those of you that have done the full marathon route or the half marathon route. So, we won't have a lunch stop, but if you're doing that distance, I would encourage you to keep that same routine, whether it's to pack a lunch or loop by your house and just make a quick sandwich and have it before you keep going. You really want to make sure you're having, that you're getting fueled up as best you can. And again, any questions or concerns, always reach out to your doctor for an official recommendation on what you should eat and drink during the walk. Decor. This has been a big question that we keep getting. Is really nothing like, and I speak for all of us on the walk team, and I think all of you as well, there's nothing like Copley Square on walk day. There's nothing like the energy and the hope, the inspiration, all those things that you feel from not only yourself, but your fellow walkers, your heroes. We hear about Amy and, walking by the hero posters and all of those other things that the finish line has to offer. And to me, this is the biggest kind of like bummer about this whole thing, is we can't gather this year in Copley to do that. But what we can do is try to do our best to make your walk feel as festive as possible. Having said that, we need your help to do that with your teams, with your fellow walkers, with your family, whoever you're doing that with. Your energy will reflect out on other people that you're with. So we ask you to kind of take that and directive and bring that to life as best you can on walk day. We know many of you want to decorate your house, your yard, your driveway, sidewalk chalk, whatever it is, to kind of put together a finish line, quote unquote, if you will. So we have hopefully some small suggestions to make your walk feel as festive as possible. There are a handful of resources, first of all, available at no cost to you on the tips and tools section of the website. So you can navigate that right from the main page at jimmyfunwalk.org. And go to the tips and tools, and you will be able to see information on there. We'll also put a link to that directly in the email tomorrow. If you visit the section, scroll down to fundraising materials, into that section on the website, you'll see the section labeled merchandise, walk weekend decor. And Jess has it up on the screen right now, where you can see the things that you can that you can receive. Some of the items that are on here, we have lawn signs. You will see actually 3 different types of lawn signs that are available. They're very limited quantities right now because we do have to order them so far in advance. So I would order them sooner rather than later if I were you. We have our roll banner, which many of you have probably seen time and time again if you've walked before. The finish line is pretty much covered in on our yellow and red roll banner. We have plenty of roll banner available if you want to decorate tables or have certain a makeshift finish line and somebody pushes through, that stuff is pretty, it rips apart pretty easily. So you can almost do a makeshift finish like that if you wanted to. We have items to download. We have a customizable hero sign. Many of you have asked us about your personal heroes that you're walking for this year. So we did create a template that you can use to make a hero sign for your hero, who is kind of your inspiration. We have photo frames that you can. It's a template that you can bring to a print store and have them print. Or if you're crafty, unlike myself, and you want to do it yourself with some poster board, you can do that as well. And then we have some signs with simply words of encouragement. They're things that you've maybe seen at refueling stations: hope, courage, determination, things of those nature. We have some of those available as well. Other ideas, you can order balloons from Amazon or something like that and create the festive red, blue, and yellow walk color themed finish line, things like that. Ask team members or kids that are around to do, like I mentioned, sidewalk chalk, and use some chalk on sidewalks or driveways when the houses that you're walking past or where you're going to be finishing. And I would say, as always, if you have any ideas on how you're bringing the look and feel of the walk to your event, you need to please let us know, because we want to be able to share more of it. We're going to be looking for content. We're going to want pictures. We're going to want videos. We're going to want all of the cool things, the elements that have brought Jimmy Fun Walk your way to each of you on October 4th or whenever you do, walk. But we don't know what you're doing unless you tell us. So we would love to hear of any fun, exciting, kind of cool things that either you're planning to do, or maybe you've already done, or that you're going to have happening on October 4th. And then when you do have them, we want to see, the results. We want to see the photos and the videos and things like that. One thing one quick caveat that I did want to mention, it's kind of a offshoot of last month's town hall. And I had mentioned the ability to download and print our 2020 Walk Hero posters for your own walk. So the official posters that we would have of our Jimmy Fun Walk heroes, to be able to line your own course. I think you'll understand this, but unfortunately, I actually spoke a little early on that, and due to kind of patient privacy issues and things like that, we're not actually able to provide our official posters to each of you to print at home. As I said, I think you understand where I'm coming from on this and the sensitive nature of it, but we will have our hero posters available on the website to view and to be a part of what we're doing. It'll be a part of our programming, but we can't actually send out direct posters of those due to privacy concerns. And again, we do have our customizable ones that you can use to create heroes, your own heroes in your own life. That I know we're just shy of 9:45 right now, and I feel like I've been kind of going on and on and on, so I want to take a breath. I know we don't have a ton of time, but Jess, I'm going to bring you in to see what questions we may have, anything that has popped up. I have the screen is minimized, so I can't see any questions, but if we've got any, please send them my way.
Yeah, we received a few before when people were registering, so I'll get to those in just a minute. And one that we did receive was, what is the deadline to reach pace setter? And just to elaborate on what you said earlier, Zach, that is as well 9/7 to get your pace setter bib. You, of course, can become a pace setter at any time, and that does impact your bib number for next year. But in order to receive the pace setter bib, the deadline is as well 9/7. So just to follow up on that. And the next question for you, Zach, is, I walked for 10 years and I'm hesitant to reach out to my donors and make the ask given everything that's going on. Do you have any suggestions?
Yeah. I think, first of all, it's a great question. It's probably, if I had to guess, it's probably the question that I've seen the most over the last 4 months, right? I want to do all I can to support the Jimmy Fun Walk in Dana-Farber and do what I can. But how do I go back to people that have, supporting me year for year when I'm not sure how they're doing financially, how they're doing, in their personal lives with COVID or any of that, right? And here's what I would say. We understand, right? We understand that this is a challenging time for everybody, and donors are no exception. We're no exception. I think we're all a part of a society that right now is reeling in trying to figure out how do we get through the next, let's hope it's not the next year, 2 years, whatever with COVID, but who knows, right? We're doing the best we can. And I think it's, you know, it's really hard to figure out who may or may not have capacity to give what they normally give, or who may not have the capacity to give at all. And an important thing to remember here is it's hard for me to say you need to reach out to X, Y, and Z person, but not to A, B, and C person, right? You know your donors far better than anybody. Instinct is a really, really good thing to trust, okay? You know them better than we do. However, here's one thing I would say is I wouldn't, and this is, I've done this personally myself, is I wouldn't be afraid to ask. In conversations that I've had, in conversations that I've had with walkers, in conversations that I've had with donors, both personally and through Dana-Farber, we found that people want to still support, even if they can't do it at the same level, right? And we also found that people don't want to feel as though they're not being considered to support. And that's really kind of like a really important part of it, is they don't want to, it's people, we've said, well, why haven't, I didn't get asked by so-and-so. Well, why wouldn't they ask me, right? Like that's, and then when they asked us that, they say, well, I was waiting for you I was waiting for the email. You do this year over year or something like that. I would say, try not to be afraid to ask, but if you know, and you just get that feeling that, hey, I should lay off this one this year, that's okay. You know, that is completely fine, but I wouldn't be afraid to make the ask. And one of the things that we found in times of recession and times of, I guess now global pandemic, is people still support charities that are important to them, but they may, in a normal year, if they give to 7 or 8 different charities, maybe they cut that down to 3 or 4 charities, right? And our hope is that Dana-Farber and Jimmy Fund obviously is one of the charities that you've chosen still to support, and that your donors would have a similar kind of outlook to it. So they still want to support, maybe they can't give what they normally would. And I've actually seen that personally myself in some of the fundraising that I've been doing for the walk. So try to, you know, make the ask. Don't feel as though if somebody gives you less than what they normally did, that's any slight on you. That's simply where we are right now, and that's okay. But just to try to do the very best that you can. And, you know, like fundraising in general, you're going to get more no's than you get yeses, and that's okay. And we just try to do the best we can. And you all know this as much as anybody. We ask, and we ask because we care. We ask because we're passionate about Dana-Farber. We ask for stories like Amy. We ask for stories like all of the heroes in your lives, because we know how important it is. So that doesn't change in a pandemic. It doesn't change in a recession. But maybe we have to be a little more nimble in the way that we make some of those asks. And we can help you with that. If you need help crafting an ask or crafting a response, or need some support on that, reach out to your staff person, and we're happy to help you with any of that.
Awesome. Well, we're getting close on time, Zach. There was one question about the July town hall and having access to those slides and that recording, which we can send in the follow-up email tomorrow. It's also available on the website and the app, but we'll include that in the email tomorrow. So anything else we can include in our follow-up email, Zach?
Okay, great. And yes, we can include prior links, and all of the content from all of our town halls are available. And if you want them, just simply ask and we will direct you to where they are, either on the web or in the app, or like Jess mentioned, the July one we'll link to in the email tomorrow. So again, I just want to thank all of you for starting the morning with us. We're a couple minutes over time. I know we try to keep it to 45 minutes, but just really do want to thank you. I want to thank Ildemaro. I want to thank Amy for being our guest today. They're both just fantastic. A reminder that our next town hall and our last town hall prior to Walk Day will be held on Tuesday, September 22nd at 9 a.m. And we're really excited. We're going to have the president and CEO of Dana-Farber, Dr. Lori Glimsher, will be our guest speaker, getting ready to wish you all well for Walk Day. And of course, we will have much more on the walk itself at that town hall. So please, if you have any last minute questions, please feel free to send them our way, and we will get back to them tomorrow in the email. But again, I can't thank you enough for all your support, your dedication to our mission. It's been 4 months of town halls and me trying to talk to you through a computer. I wish we could see you all in person soon enough. excuse me, soon enough, hopefully, but please continue the great work that you're doing. It is inspiring every day to see everybody come together for our mission. And we know we have so much in common, and we want to continue to do all we can to fund the vast needs at Dana-Farber right now and long into the future as well. So any questions, please let us know. Again, thank you for joining us this morning. Wish you a great rest of the day, a great weekend, and we will speak in September, on September 22nd. So have a great day. Thanks so much. Bye-bye.